Welcome to The Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. We have a great guest on the program today, Taylor McPartland. He is the CEO of ScaleHealth. Taylor, welcome to the program.
Thanks so much for having me, Tom. Pleasure to be here.
Taylor, ScaleHealth, I'll be honest with you, and for full transparency, ScaleHealth has previously recognized the organization that I work for, but I will be honest with you, at the time, I didn't know ScaleHealth. And I don't know if that's a good thing or a bad thing, but I've been following you ever since, frankly. And I'm realizing, I was on one of your conference calls earlier in the week, and it really was a compelling positioning that ScaleHealth took when you guys were talking about the needs of a particular client. And what I really liked about it is that the organizer of the call was really trying to drive from the vendors to, one, understand what the client's needing, and two, pull out your innovation hat, do something different, be bold, right? So those were really, I thought, a differentiator in and of itself, and just in my own personal experience. So my hat goes off to ScaleHealth. You now have a loyal follower. Different than 6 months ago, because I really think that you pull in that innovation, and that's what the virtual shift likes to talk about. Is that who are the shifters? And I do consider ScaleHealth as one of the shifters. And what do you guys, therefore, what do you guys see in the market? And what do you guys and what does ScaleHealth believe is the next generation, if you will? So let's kick off the conversation. Tell us a little bit about yourself, and tell us a little bit about how ScaleHealth got going.
Well, I appreciate that. And thank you for the kind words. Background on myself. We're talking about innovators and entrepreneurs here, and that is my background. I'm a builder. I'm someone who is passionate about working with innovators and with entrepreneurs who are dedicating their lives to tackling some of the biggest challenges that face our society and face our friends and neighbors all around the world every single day. And the healthcare industries and our collective health is certainly at the top of that list. And so for me, my background, I'm a serial entrepreneur, Northern California native. I now live in Southern California, which is where, although ScaleHealth works all around the world, we're based in Southern California. And for me, I run a company previously for a number of years, and when I stepped away from that, I really I took some time to think about what I was really passionate about, and for me, it was doing everything that I could do to empower those thought leaders, empower those innovators, empower individuals who really were, looking at industries like the healthcare industry and saying there's room for improvement here, and I want to dedicate my life to improving it. And as we both know, there's so many aspects of the industry that could see improvement, and there are so many good people working towards that future, that I feel like my role and the role that ScaleHealth plays is really doing the blocking and tackling, and really doing that and matchmaking to make sure that someone with the vision for what the healthcare industry should be can focus on the hard enough job of growing their company and putting their company in a position to succeed and to really drive impact. So that's what gets me excited. The company was founded in 2018. We have seen a tremendous amount of evolution and growth, certainly because of and as a result of the COVID pandemic. And now we have partners and innovators in virtually every state, and in many countries around the world, from all across Europe to Australia, Pakistan, Iceland, Peru, and we're
Really?
bringing on about 3 to 4 new innovators every day. So,
Interesting.
our work is just getting started, but we're having a lot of fun.
Yeah, that is very interesting. I did not know that. So let me just read for the audience the vision of Scale Health. The vision of Scale Health is to ensure that everyone has access to innovative healthcare solutions that they need and deserve. That is, to me, that's a lot of what am I trying to say? Need and deserve. I absolutely agree. Or there's a challenge here. There is a lot of innovation, and I was a patient portal product manager 10 years ago, and people would always say, they're never going to use it. That they're never going to use it. Grandma's never going to use it. And I got an 84-year-old mother-in-law, and she uses her smartphone every day, and she's always
Absolutely.
on different apps. So I just don't buy the grandma's not going to use it scenario. There's probably some scenarios out there that where grandma isn't going to use it, but with today's day and age, I'm soon to be 62, and I got to believe that people 10 years older than me are just as 10 and 20 years older than me are just capable of using technology to advance their cause. And what better way to do it? And I am a believer, like you, I believe, when you talk about innovation, is that you don't have to go inside the brick and mortar to get healthcare. It is a care anywhere model. And with the innovation that I always hear Scale Health talk about, that they buy into that. So what do you see out there from all the competition out there? There's a lot of noise. It doesn't always, it's always it's always difficult to rise above it. But what are you seeing out there as you look at all these different vendors, and what do you find is some of the differentiations that are available today?
Yeah, I think it's a great question, Tom, and I look at it from three different perspectives. The first being from the perspective of the vendors, the innovators out there. They are spending, and this is where I started just alluding to the blocking and tackling concept, but they are hungry they have an amazing idea, they have an amazing vision, um, and they're hungry to try to find the right uh, partner, whether that be we refer to them as health organizations, but it might be a provider, it might be a payer, it might be a corporate, a government NGO, um, but they're hungry to try to find a partner that is meeting them where they're at. And so there's a lot of time spent knocking on doors, trying to understand, you as a potential client of my innovation, is this something that would be helpful for you? What do you need to see from me? Technical compatibility considerations, there's budgetary considerations, there's just the burden that is put on health systems in this day and age that it's getting harder and harder for them to adopt innovative solutions into their daily practice. And so, from an innovator standpoint, a lot of what we try to think about is how can we, and you alluded to this, during the webinar the other day, how can we really break down those barriers so that it is very clear a startup all around the world coming into the Scale Health platform can very clearly see what health organizations are in need of their solution and what they need to do to best position themselves for that conversation with that health partner when the time is right. That's the first thing that we look at, or first thing that we try to address when separating the signal from noise and in the space. Second is the other side of that coin. Looking at it from the health organization standpoint, they want to be innovative. These decision makers at a health system, but they want to be innovative, want new solutions for the challenges that are keeping them up at night. They have hundreds, if not thousands, of bound pitch requests every single day, whether it be on LinkedIn or emails, and they don't have the time to take 15-minute conversations with each one. Conversely, they don't want to delete the one that actually could save them time and maybe save their hospital or jobs on their team. And so they're kind of stuck between this rock and a hard place. And so what we try to do there is really the inverse of what we do on the startup side, and say, you tell us what you're looking for, and tell us what, when you go to bed at night and you think, if there was a perfect solution out there that did this and hit these 3 bullets, that's a no-brainer for me. I want to spend 30 minutes talking to that solution. I want to seriously consider piloting or partnering or implementing that solution. And so we do that legwork to identify the right solutions, again, from around the world that they should talk to, and save time and save money on both sides in that way.
Yeah.
And then the last element is just from the most importantly is from the patient side, and just thinking through with all of the solutions out there. I mean, you made a great point about rural populations, elderly populations, the digital gaps or the challenges around technology adoption from patients, maybe the challenges or the lack of challenges in adopting technology. But how can patients really find a solution or leverage a solution that really meets them where they're at, taking into account their location, their primary language, their illness or what brought them to the hospital in the first place. So we get really excited about working with solutions that are able to, as an example, delivered to the patient via text message, the message, a video of their doctor speaking to them in whatever their primary language is, saying, hey, Tom, thanks for coming in today. Remember, here's what I want you to do, and I look forward to seeing you again, in 2 weeks or in a month. And in that way, just do away with, the thick packet of papers that they may or may not read or may not be able to understand when they leave the hospital, and just put them in a much better position to be able to, like I alluded to in our vision, just put them in a position to be able to have access to the care that they need and that we firmly believe they deserve.
Well, what would you define as more innovative? Feature, function, or clinical outcomes? And the reason why I ask that is, with remote patient monitoring, chronic care management, you always hear a lot of vendors say, hey, use us. We can make you $200 per patient per month richer, right? And so therefore, we're the chosen one. But at the end of the day, when you get to the deployment, they're only 65% compliant in the 16-day measure, but yet they're still paying $40 per patient, even though that provider doesn't have any reimbursables. So feature function to me is important, especially more so in the rural setting, and how do you reach those patients? But in my view, innovation is centered on outcomes, clinical outcomes. How do you move that patient along the awareness to a wellness continuum, and then hence be able to establish a better lifestyle because of your engagement? What are your thoughts on that?
I completely agree with that, and I would even take it a step. First off, I agree, but I would even take it a step further and just think about the concept of innovation, not so much as a separate startup or as a separate department, but as something that is really built inherently into the decision-making process and strategic direction of organizations. We hear the term innovation and we think, okay, that's going to disrupt everything. That's, we're going to, it's going to,
Exactly.
if I'm 30-year veteran at a hospital and I'm hearing, oh, we need to be innovative now. I'm thinking, well, that, what does that mean for me? And I think the challenge there is that not that innovation has become a negative word, because I think it's a great word and it's something that we should be embracing, but it's a word that's kind of we use it so much that it kind of loses its meaning to a certain
exactly.
extent. And
Exactly.
I think that if we look at, I'll use the word, but if we look at innovation as just a way of looking at the way our process is and making sure that our process is nimble enough so that if the opportunity presents itself for that incremental financial improvement and we decide that that's a route we want to go, great. if that comes down to like, being able to plug in something that might be a larger solution that touches more departments of our hospital, or our health plan, but drives much broader, more improved clinical outcomes, amazing. But it shouldn't, in my mind, innovation shouldn't be something that's sidelined as a nice to have. It's not a vitamin,
It's not.
it's a pain it's it's a pain pill.
Okay, it's a big. Yeah, so if you look at it from a clinical perspective, we have more, and where we spend our money, right? The whole notion of value-based care is to increase the greater reduce the cost of care while increasing the quality of wellness or the state of wellness in each patient, right? But we have more folks with diabetes today than yesterday. We have more people that are obese today than yesterday. And that's almost verbatim for every clinical category. So and this is not a negative towards the providers or health systems. It's just, we do have some other macro trends, right? We have an older, ager, sicker population with less doctors and nurses. To me, that's the problem, right? So how do you provide greater quality of care and reduce your costs when you have less doctors and nurses available to treat that older, ager, sicker population? To me, that's the challenge. So how can we be innovative in how we deliver care with some new tools outside of the brick and mortar that ultimately changes lives? And so that's really, and to me, as my audience knows, I'll rattle off my standard stick, and that is the average Medicare patient has 5 chronic conditions, sees 9 different doctors, only in front of their doctors. I should say they're in front of their doctor 15 hours in a given year. Change, wellness occurs in the other 8,745 hours when you're not in front of the doctor. And that's really where innovation has to come. It's meeting the patient, to your point, where they're at and when they need it, and be simple about it relative to how do they access that technology, if you will, and how do you access that clinical content or educational programs, or making it easy to check your glucose level or your blood pressure and stepping on the scales and things of that nature, right? So to me, that is really what innovation needs to focus on. Innovation in how we change the way we engage the delivery of care in the 8,745 hours we're not in front of our doctor. That's where outcomes are going to be delivered the most. Thoughts on that?
I completely agree, and I think it's looking outside, and I love the breakdown of hours that you just mentioned there, because it's so jarring when you hear them. And I think there's things that can be done on both sides there. Those 15 hours in front of your doctor, how can we make sure that the doctor is able to be not only physically, intellectually, and emotionally present with you there, and not spending the majority of their time focused on their typing into this screen, or thinking about they only have 30 seconds with you for this particular appointment because they have to do all of these operational or administrative things
Exactly.
separately. I think that's huge. I think also to your other point, those remaining hours, those hours that are focused on the hours that really are dedicated to how well we can be as people, how healthy we can be as a population. I'm really passionate about those kind of big picture thoughts, and thinking to myself, okay, well, if it comes down to so much of wellness being what we eat on a daily basis, what can be done to influence one member in each household to eat healthier? And if that person is the same one that is buying the groceries, what can be done to influence to buy healthier groceries? Or if they can't afford them, or if they don't have access to a grocery store, what can be done to address that? And so we're obviously talking about very big challenges and big problems, but they're the problems that need to be fixed. Otherwise, we're not going to reverse this trend, this very negative trend that we're seeing.
Yeah, and you're right on many on fronts there. So I always talk about the patient not only needs access to care, they need access to a cure. And I will never
Hmm.
forget the episode that I had many months ago with a civil rights leader, and he was saying that in the urban neighborhoods, when a patient is told, "Hey, eat better," right? Lose some weight and diet, they go down to the neighborhood grocery store and there's 66 different flavors of beer and potatoes, potato chips and pretzels, but there's no apples and oranges and tomatoes and lettuce, right? So, having access to that cure is just as important, and that leads into the idea of equity, right?
Hmm.
I'm not a believer. My audience knows that I'm not a believer. I'm hopeful. I pray for, frankly, for better equity. But and I've been saying as of late, until the politicians use their state level Medicaid insurance program as their insurance program, they're never going to realize what they're asking their people to go through and what to use, because they're just not in that space. They don't see it the way their their people see it, if you will. So equity to me is equal access to care. It doesn't matter who you are, what color you are, what orientation you are. It just care is important, and health and wellness is something that you have to embrace, and you should have the right to access whatever you need in order to achieve that state. I don't your thoughts.
Yeah, I mean, I keep thinking back to a story that I heard, not too long ago from some of the providers that we work with, and they're coming to us and saying, when we have patients coming in who are, we're prescribing them, potentially life-saving medications that they need to take, and they need to make the decision on taking that medication or being able to buy food. Like,
Exactly.
what kind of a choice is that?
Exactly.
That's something we need to fix.
Definitely need to fix. Yep, I myself have been at the counter at CVS saying, "Hell, how you doing? Come on, good RX," because I ain't paying that price. So anyway, we joke, but it is a very serious situation, and the state of healthcare delivery and the ultimate objectives is slipping away from us, in my view. And we need innovators to influence the outcome side of the equation more than buy my technology, it'll work type of thing, right? Because it's cool and
Yeah,
it's sexy, right?
yeah.
So we have a minute left. Tell us what's next for Scale Health.
And we touched on it, or we alluded to it here a few times. For us, we have some amazing initiatives that are live right now, on the Scale Health platform. We also have some really exciting ones coming down the pipe in the very near future, all with a focus on bringing together decision makers and health organizations, with amazing innovative solutions, that are really trying to drive positive outcomes, to allow all of us and all of our neighbors to live the healthier lives that they deserve. From our standpoint, we're looking to further continue to build our technology and continue to drive downstream so that we are not just bringing those two sides to the table, in a way that saves both sides money, but we're actually able to alleviate the burden on both sides and do everything that we can do to ensure that once there is that connection, once the health system is able to identify the one several innovators in the scale health ecosystem that they want to work with, that we can do everything we can do to ensure that initial partnership really does turn into an amazingly productive, healthy and impactful marriage long term
Yeah.
for both sides. So that's where we're going on the technology platform, and then, on the ecosystem, side, we are going to be doing a lot of traveling over the second half of this year. We're going to be at the health conference. We're going to be at a number of other conferences in the fall, and so anyone listening to this, we would love to have you come by, and if you see the ScaleHealth logo, we'd love to say hi and love to learn more about what you're doing and just see how we can best help.
Awesome. We'll leave it there. Taylor McPartland, CEO of ScaleHealth. Thanks for joining the program. Great conversation. Appreciate it.
Tom, thanks so much. Pleasure to be here.
That's today's shift. I appreciate the audience taking the time to tune in. If you missed part of today's episode, you can tune back in at the healthcarenowradio.com at the same time, 11 a.m. or 7 p.m. Eastern throughout the week. And be sure to check out the program page at thevirtualshift.co. As well, remember to follow me on LinkedIn, Twitter at FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.